Okay, well, thank you all for, excuse me, thank you all for joining us. So this is an IRB brown bag session. Today we're going to be talking about the smart forms. There's a lot of information that we'll be going over. The slides and the presentation will be posted on our website though, so don't feel like you have to scramble to catch everything right now. So we will go ahead and get started. All right. So like I was saying, this is a presentation focusing broadly on the smart forms, although more specifically, the idea is why studies get returned to study teams. So as a little bit of an overview, we'll talk about why studies get returned, and then we'll go into a little bit more detail about each of these things that can sort of be polished and can help make sure that submissions move through the process smoothly and as efficiently as possible. So just as a brief reminder, this is the IRB review process. If you've been to these events before, you probably have seen the diagram here. Basically, we start reviewing when the study is submitted. The IRB staff will do a pre-review. So this involves sometimes getting clarifications, questions, requesting additional information from the IRB staff to the study team. So you may get your study returned to you there for additional clarifications. After it goes through pre-review, studies are sent either to expedited review, exempt review, or assigned to an IRB meeting. IRB meetings, of course, being for full board studies. At this point, the study will either be approved with contingencies, or if it's a full board study, it could be tabled. So at any point in this little process here, you can be asked for more information, either from staff, from reviewers, or from the full board. And then once you get through all of that, the study will be listed as awaiting correspondence. And once you get the final document from our study team, you are ready to go. So since there's a variety of sort of junctures where studies can get returned to teams, the goal of today is to sort of go over some of the big things that we as the IRB staff and as reviewers see from studies that end up causing little hiccups or end up requiring additional clarification. So we're going to be talking about missing attachments, branching errors, insufficient detail, and then inconsistencies across smart forms. So first up is missing attachments. So when we review studies, if you are submitting to us, there's going to be certain things that will be required within the submission. Now, this varies a little bit depending on the type of submission that you have. If you're doing a data chart review or an exempt study or a non-human study, the specific layout of these may change a little bit, and the smart forms will guide you through the process of what specifically you need. And I will put a plug in here for our sandbox. So if you go to my IRB, there's a sandbox where you can essentially test out the smart forms and test out the application process. So you know exactly what forms are going to pop up. You'll know exactly what you're going to need to provide to us. And it's a really nice way of exploring the site and making sure that you have everything that you need before you go ahead and submit. So like I'm saying, some of these may vary. Some studies may not have all of them. But these are things that frequently come up when we see studies. So protocol, informed consent, questionnaires, interview guides, and then subject-facing materials. So for a full board study, without these materials, the study can't be approved. And essentially this is because the reviewers don't have the necessary context to review the study and know specifically what's going on. And again, there's a lot of nuance here and it will vary depending study by study. But in general, a lot of studies are going to need this. And if you do have a study type that doesn't request these specific documents, the smart forms will kind of guide you to the equivalent. So when we talk about attachments, protocol is a big one. Again, this is for most studies, data chart reviews, banks, some of these other types have their own specific thing. But for things like expedited and full board studies, protocols are a big thing. So when we look at protocols, one of the things that we look for is that they're formatted within our template. And the template is important because it contains all of the required elements that the reviewers are going to be looking for. So it'll give information, what study procedures, are there conflicts of interest, the risks, the benefits to subjects. So by following the template, by formatting your protocol with this template, it makes sure that all these required elements are included within the submission. Now we know that not all protocols are written by people here at UF. So for sponsor written protocols, one of the things we ask you to do is to indicate what specifically is going to be done here at UF. So sometimes this is in the protocol, sometimes in the document itself, it'll say. Otherwise, what we ask you to do is to just take a look at the template that you would be using to create a separate protocol, and essentially just write out in brief and sort of fill those different sections out. And then you can upload that document to question 3 of the miscellaneous smart form. And the reason for this is because with sponsor written protocols, I see we have a raised hand. Yeah. Yep. Oh.
I can wait until you get to this, Lauren. I just wanted to make a few remarks about seeded studies. So whenever you get to it, I'll try.
Yeah, so seeded studies are going to be a little bit different. But basically, the idea is the reviewers need the information within the templates to effectively review the study. And sometimes with sponsor written protocols, especially protocols where there are different things being done at different sites, or sometimes we see studies where one site will be randomized to one condition and another site will be randomized differently. Saying specifically what's done at UF really helps clarify for the IRB what you're asking for approval to do here at this particular site. And then you don't get a bunch of questions about things that aren't done at the site, aren't relevant. So yes, seeded studies are a little bit different.
Yes, so thanks, Lauren. You were very responsive to the raised hand, so the timing was a little bit off. I apologize for interrupting, but I want to say a few words about seeded studies, because the strategy that will apply to the multi-center protocols when we are actually approving ROPs is slightly different from seeded protocols, where we don't have the regulatory oversight, but the single IRB has the regulatory oversight over the study, and we are only conducting local context review. Local context review doesn't amount to approval of any sort. It's, again, as it says, the local context review. So although we will ask you if you're not conducting the same all the same activities as other sites to describe what you're doing, but we are not approving your activities. Your activities have to be approved by the IRB of record, and therefore have to be an integral part of the consent that's approved by the IRB of record. So we can't approve your piece here locally because we don't have regulatory oversight over the study. So I just wanted to emphasize that this caveat for everyone to appreciate the difference between these two scenarios. Thanks.
Yeah, so it's one of those situations where, like I was saying, each individual study type can have its own sort of specifics. I see we have a couple other raised hands though.
I had one quick question. How much latitude do you have to change the templated language in the protocol or the ICF?
So at least.
Well, I think it's the ICF primarily. Sorry.
Okay. Yeah. So we're going to talk about the ICF next. The short answer is it's going to depend. Again, a lot of this is going to depend on whether or not this is a sponsor written protocol, whether it's something that's seeded. So in general, we advise using the templates, but if there's something in particular that is different because of the way the study is set up, the way it's sponsored, whether or not it's going to be single IRB or seeded, that would be something that would be teased out in the smart forms. And then if there's specific questions, you'll be able to contact us and we'll be able to help you out.
I guess maybe to word that a little bit differently, because I know you can make some changes, it would be, are there certain language that must be maintained? For example, they talk about participants' rights, and maybe this is not the appropriate section for that, so I apologize. But
no, I'm fine.
Are there certain language that you can't change because of, sort of regulatory and or making sure that you're informing participants of their rights? That sort of IRB templated language?
Yeah, so Is this for a UF, like instigating?
Yeah, like a single PI, maybe full board.
Okay, yeah, so if it's something that's coming out of UF and it doesn't have some of the additional complications that come with things like SIRB or seated studies or other other types of studies, we do recommend that you follow the templates as much as possible. So our website has a list of signature sections and required template language. So there are specific, if your study is using an MRI, for instance, there's a page that has the template language that we request you use for MRIs. And you can go in there and you basically just pull it out and then you can plunk it into the informed consent document. So the ICF's templates are basically written to ensure that all of the required information from a legal and then a consenting standpoint are included, which is why we generally don't recommend modifying them. But again, if there's something specific going on, it might be worth talking to one of the staff members to get a little bit more context into why the language might not work for what you're looking for. So I hope that helps. So
Thank you.
Yeah. So in terms of informed consent forms, this is another one that we sometimes see. So one of the things to remember is you may need more than one informed consent form. These are not always required. It really varies, again, depending on the individual study. But a lot of the times we'll see different subject populations. So if you're doing a study that's comparing 18 to 25-year-olds and then 60 to 75-year-olds, and the procedures are different, you may want to consider having more than one informed consent form. Partially, this is because it makes it easier for the study participants themselves, and it also makes it easier for you because as opposed to writing a form that has a bunch of different clauses, if you're this group, if you're that group, having separate informed consent documents can make things easier. But more specifically, if you have, say, a group where there are controls and then a group where there are patients, if the procedures that are happening to each group are dramatically different, or if you're dealing with different populations, so if you're interviewing providers about a medical procedure and you also want to do a survey of patients, the information that the providers are going to need to know about participating is going to be pretty different than what the patients are going to need to know. So in cases like this, you may need more than one informed consent form. So being sure that you know how many subject populations you have, whether or not the procedures are dramatically different, can make a big difference in terms of the informed consent process. Likewise, if you have subjects who are going to come of age during the study, if you're enrolling 16-year-olds and it's a 5-year study, they're going to become 18. They're going to be able to consent for themselves. So you may need to have additional consenting processes for them. And the details for that are going to be on our website. And then the same thing for waiver of documentation of informed consent. We have a template letter that we asked you to use. So if you're applying for a waiver of doc, so your subjects are not going to sign, but they're still going to be consented, they're still going to have that information. Providing that information in the waiver of documentation of informed consent format makes things go very smoothly. Likewise, well, I'm talking about template language. So we have templates and we have different signature blocks and the specific amount, specific procedures, specific additions, depending on what you're doing. So if your study is using genetic testing, we have standardized language for that. Like I said, MRIs, if there's reproductive risks, we have standardized language that you can put in the ICF. And again, the reason is to make sure that all of the requirements from a regulatory and institutional and in an ethical sense are included within these documents. So making sure the signature blocks are correct is another thing. If you are going to be getting assent from minors, make sure that you have the little section that has a place for minors to sign. Same thing if you're using legally authorized representatives. And so all of this is within the investigator guidelines and it's on the pages, but it's worth mentioning just because we know study teams are working most of the time on a variety of different projects, different populations, different groups. So the goal here is to put all of this in one place, sort of, you can look through to make sure, yes, we've got these particular elements. If your study involves social and behavioral items, before a study can be approved at the end, we will need to see those items. If you're going to be doing questionnaires, you'll need to provide that to us. We have on question 1 of the social and behavioral SMART forms, there's a way that you can check off specific questionnaire items that have already been looked at and evaluated by the board. If what you're doing doesn't fall into those categories, we try and make it so that most of the standard ones are included. But if yours isn't there, we ask that you upload it to question 3.1, and that's where you can upload questionnaires that you've developed or questionnaires that are combinations of other things, so on. One of the things in terms of uploading questionnaires and items that are already developed is please don't attach journal articles. And the reason for this is depending on the individual journal article, first of all, finding the questions within the article can take a little bit of time. And there's also journals that will publish the results and they'll publish the correlations and the findings from a study, but won't publish the questions itself. Some journals will ask for that. You'll need to ask for that as a supplement. So just to make sure that we can see the questions subjects are going to see, we ask that you put the questions themselves as opposed to a journal article. For qualitative research, we know that interviews and focus groups, qualitative research in general, follows a little bit of a different path. So when you're doing an interview, when you're conducting a focus group, it's quite possible that because it's a conversation, you're going to flow within the conversation. You don't have a script that's going to work for every individual person. You may need to ask follow-ups or clarification. And we understand this, we know this. So when you're submitting social and behavioral items and you're including these qualitative type topics, we do ask that you include a guide that asks, what are the kinds of questions you're asking? What sort of topics are you going to cover? And we understand, of course, that these things do follow the flow of a conversation. And that's what makes qualitative research so interesting and so challenging in some ways. So we do recognize and respect that, but it is something that we're going to need to see. Sort of generally, what are you asking people? Finally, subject-facing materials. So one of the things that we see somewhat frequently is things like phone scripts or recruitment and advertising materials that don't follow the investigator guidelines. So phone scripts in particular, one of the things that comes up quite frequently is within our guidelines, we ask that you tell subjects, hi, this is who I am, may I speak to, and then the subject's name, the target's name. And the reason we do that is if someone is calling a potential subject, hi, my name is this, we're interested in seeing if you want to participate in a study on fill in the blank there. Whatever fill in the blank there is may not be something that the subject wants anybody else to hear. So if somebody else picks up the phone, it's good practice to make sure that you're asking whether or not you're talking to the given subject before moving forward. And so all of that's within the investigator guidelines. And so it's just a good idea to review those to make sure that all of the little details are in there. Same thing with recruiting and advertising. So one of the things that comes up is per our guidelines, you're not allowed to emphasize the amount of compensation. So you can't have a flyer that is essentially description, and then in big bold print, you can get $50. It doesn't give people the information they need. It can be coercive. So it's in the guidelines, and just making sure that the materials follow these guidelines can move things along quickly. And if the subjects are going to see it or hear it, we need to see it or hear it. So this means if you have email or letter templates or phone scripts, flyers, posters, if you're going to be showing your subjects it, or if you're going to be reading it to your subjects, it's something that you're going to want to submit to us. So there are some things that are frequently forgotten. And just as sort of a reminder, because some of them don't necessarily fall under what you might usually think of as recruitment, but they are scripts and things that subjects are going to see. So one of the things that we've noticed a lot is as more and more people go into e-consent and are using things like REDCap e-consent, you're going to have to send these subjects a link to that particular REDCap item. And a lot of the times you'll be sending them a Zoom link too to go over the e-consent process. So the information that you're providing within that, we ask that you have some sort of template so that we know, again, what the subjects are going to be seeing. So same thing if you have questionnaires that are going to be distributed at 3-month intervals, or you're doing weekly follow-up phone calls. It's just a way of making sure that the materials are all there, that they reflect what's in the protocol and in the informed consent, and everything is really tight and neat. So you can upload these things to the recruitment smart form. You can also upload things like this to question 3 of the miscellaneous smart form, which is going to be kind of your catch-all for everything. Next up, we're going to chat a little bit about branching errors, specifically the study type smart form. So my IRB is set up so that the smart forms guide you through the process to get the information that you need. And we try to minimize the amount of information we ask for that isn't relevant to what you're doing. So it's done through what we call branching logic. So if you check a specific box here or there, it leads to other forms. Other forms will either disappear or will be pulled in. So this guides teams to fill out the necessary forms based on the study that's being submitted. The issue is that if there's something that isn't accurate, isn't the best option earlier in the submission, it can cause compounding errors a little bit later. So one of the things that we see is the study type smart forms. It's one of the more common errors that we see, and it kind of creates a roadmap for what's going to be included in the study. So you've probably seen this if you've submitted to us before. All these different checkboxes, options for things that people may or may not do in their study. Banking is one of the things that comes up fairly frequently. If you're going to be banking, if it's going to be a non-local and off-site bank, if you're going to be collecting data, samples, contact information, and it's, again, a separate entity, you'll need to check banking to make sure that it shows up within the smart forms. Internal banks are a separate submission. So if you're doing a study and you think you might want to contact these participants later, and so you just want to collect names and emails and phone numbers, that would be a contact registry. And that's going to be its own separate submission within the MyIRB system. So it won't be in this protocol and this informed consent document. It'll be in that own separate submission. And if you're doing something that is only a bank, on the requested review type page, which would be a few pages before this, you would choose banking only. Behavioral and social research. If you're going to be doing interviews or focus groups, we ask that you check this because it brings in a variety of smart forms that collect specific information about behavioral and social research. So it'll bring in some questions about, are you asking things that might be sensitive? Are you asking things that might have the potential to cause social stigma or damage somebody's reputation? And these forms aren't there when you don't select this. So if you're doing interviews or focus groups, if you're sending out big questionnaires, it's good to check this box because that gives us that additional information. And it also brings in the smart form page where you can actually upload all of those documents that I was mentioning earlier. So it's a useful tool to make sure that you're capturing things. So we've got a couple raised hands here. All right. Ivana, if you want to go first. Ivana? Okay.
Yes.
All right. Did you want to add something?
No, sorry, that was an error. I didn't raise my arm.
Okay. All right. We'll start with Chris.
Yep. So just when you get to the survey smart form page, the library is pretty limited as far as the questionnaires and surveys that we use in pediatric oncology. So when you're uploading the form, you're going to name the form and it asks for a description of what the instrument is. Do we have to fill out that description, or is it okay to just name the document and upload the document? What are you looking for as a pre-reviewer?
So from a pre-review perspective, it's useful to see what the document actually is. And part of what we're looking for is if there's studies that have different subject populations, or things that not everybody is going to fill out, mentioning this is for part 1, this is for part 2, and these are the subjects that'll fill it out. It's a way of letting us know who's going to be seeing it, in addition to sort of giving this broader description of what the item is. So it's another place where you can essentially add notes to sort of clarify things for the teams going forward. Okay. Does that kind of get at what you're asking?
Yeah, it's just painful when you have 20 or 25 instruments,
Yeah, no,
to describe.
yeah,
And
well,
getting it and getting them added to the library doesn't seem like it's a simple task.
So Chris,
Yes.
a brief description would suffice. And of course, the more questionnaires or instruments, the harder it is. So keeping it brief is fine. As far as adding it to the library, that is a difficult task. When we initially added the questionnaires that are currently in the library, we had to engage several consultants, some of which are board members, to evaluate the risk of instrument. And so a lot of them are not validated. So the ones that will be in the library would be the ones that are validated and
Mhm.
uh, can carry a determinate risk level with them. So it's a,
That's fine. It'll just be the painful going forward. Thanks.
Ellen?
I'm not sure how to undo that raised hand. That was from earlier.
Oh, okay, sorry.
I'll look to see if I can.
I
Oh, I
think
can. I see. Okay.
There we go. All right. So research-only procedures. This is another one that sometimes study teams miss. If you're doing procedures that are basically done for research purposes only, we ask that you check this box. So if you have somebody who is getting an additional blood sample drawn, maybe they're in the lab already and they're getting 2 vials of blood drawn, and you want a 3rd vial for testing. You're drawing that blood for research-only purposes, and so you would need to check that box. Same thing if there's going to be pregnancy testing for the purposes of enrolling in a study or other labs and procedures. It's a way of flagging for the reviewers in the study team, the IRB teams, sort of what to look for in the protocol and elsewhere. Chris?
Yep. So I think in the past, and I don't know if the smart form page is still there, we would upload what was submitted to OCR, so the grid, or describe what those procedures were. Is that smart form still there, or has that been eliminated?
Yeah, that smart form isn't there anymore.
So there's really nowhere to describe what the procedures are. Is that correct? They'll just be in the protocol?
Well, specifying in the protocol what's standard of care versus a research-only procedure, that is one place where you can indicate this is what we're doing only for research. And it also would come out in the informed consent. So the items that say this is being done only because you're a part of the study, those would be another place where we would look for research-only procedures.
Okay, but within the context of the smart forms themselves, you're not going to be, there's nowhere to really put that information anymore, correct?
Yeah, we don't have
Okay.
that specific smart form anymore.
All right, super.
now
Okay,
to shed some background light on this, those smart forms were eliminated because it became clear they were made for RAC then and OCR now for their use. It turned out that they never found these pages useful because they have a separate parallel intake process, so they were not really useful to them. And we didn't want the PIs to duplicate the entry into my IRB. However, checking research-only procedures is important because it indicates that there are research-only procedures, and then there are behind-the-scenes flags that set certain ancillaries based on that selection.
Okay, thank you.
So missing details is another thing that can cause a little bit of a slowdown when it comes to the review process. So in terms of the protocols, again, we have the templates describing specifically what's going to be happening to each subject population. It's not a specific question within the protocol, but protocols that mention these are the subjects and this is what we're doing to them can be more easily reviewed by the IRB staff and reviewers because you know specifically what's going on with each individual subject. So obviously there's specifics within the protocol process, but just making sure that it's clear basically what you're doing to who is a way of moving forward with the protocol. Ellen?
Yeah, I have a question. So I think the reading level for maybe your ICF, which is sort of where I'm stuck right now, but for the ICF should be maybe at the 8th grade level. Is that the recommendation, or is that sort of mandatory? That's what you need to do your ICF.
That's recommended. Basically, when it comes to the reading level, we just need to make sure that study participants are going to be able to understand what is going on. And in reading levels, the tools that are out there they're useful, but ultimately it's something where the IRB staff and then the reviewers look at and then evaluate, is this something that study participants are going to be able to understand? And
well, because I think that if you were to look at just the IRB templated form, if you just pull that one up, sort of the one that requires all your HIPAA, protections and so on, the reading level is definitely above an 8, close to a 10. I mean, it's a 10 point something for sure. And so if the reviewers are like, well, you need to bring your reading level down to an 8, but you don't really want to change some of the templated language that fits, not the ones that don't, right? You've already recognized what fits and doesn't fit. It is extremely difficult to do that.
Yeah, so in terms of that, so the reviewers, we recognize the things that have been added to the ICF, institutional and regulatory and legal for those sorts of requirements. Usually when you get a request to revise a study to make the reading level lower, a lot of that comes in question 5, the details there, and then question 7, and then question 12. And that's where the details specific to your study are going to come in. Again, it comes to what is going to happen to a subject if they're going to be enrolled in the study.
Dr. Terry, it's a point well taken, but let me a little bit demystify how the IRB approaches to the reading level of the consent. We don't run a software that actually says, okay, you're 8.1, you're out, or you're 10, you're out. But as Lauren pointed out, we look, for example, at the section, what will happen to you if you participate in this study. And then sometimes study teams would use polysyllabic terms describing medical procedures that you need to know medical jargon to understand what will happen to you. Like, you will undergo spirometry. Okay, what is spirometry? So you have to use descriptive language to tell people what it is. So in that sense, if you were to look at our template and run the reading level software analysis, you may get an outcome 10 or something like that. But that's not the point, because we don't approach it that way. We just use the descriptive term reading level 8th grade or such to qualitatively describe rather than quantitatively describe the expectation. So really, if you follow the rule of thumb to the effect that use descriptive terms rather than medical or subject specialty jargon, that would be sufficient to pass through. So we don't really nitpick through that, so long as it's reasonable to assume that somebody who doesn't have much education is able to understand what would happen to them in the study. I hope that helps.
Yeah, theoretically, I'm sure it does. But when reviewers are insistent that you need to get it down to an 8th grade level, then they're looking at the entire document in order to make that happen.
I see. I would be happy to go together with you through a specific case so we can together kind of identify what the troubling points were. Thank you.
And just as another sort of plug for our website, we also have a sort of a translation tool. We have a list of common procedures, common medical terms, and they're written in lay language. And the goal there is to, again, help translate some of these more technical terms into terms that subjects will be able to understand. So when we talk about details, consistency is another thing that comes up. So we need details to be consistent across documents and across smart forms. And it does contribute to submissions being returned, because essentially we're asking which form is the one that we're going by. And this is something that happens, and I know from when I was doing research and protocols myself, it is very easy to make a change in one place, and then you do have to change it in a bunch of other places. And like I said, we know that study teams have a lot going on. We know that there's a lot of different studies, lots of different things. But from the review perspective, this is something that is just useful to pay attention to. So to help out with this, one of the things I want to share is I went through and sort of tried to create some information, smart forms that essentially hinge together. So for this one, study staff, risks and benefits. So when you look at the study staff smart form, the study staff smart form itself is going to have this information. A lot of times you also see the study staff listed in the protocol and on the informed consent documents. So the PI will be listed on the informed consent document. Research coordinators and other contacts are also often listed on the informed consent documents. So if you're making an update to your study staff, so somebody leaves you up and they're not with the study anymore, checking the protocol and the informed consent documents to make sure that they're no longer listed there, in addition to updating the study title and staff smart form, can be a way of avoiding, getting a comment, harmonizing this or that. So essentially, because we do have so many different smart forms, because there is a lot of information and a lot of opportunities for different details, just wanted to go over very quickly some of the big ones that we see. And this hopefully is a resource and something that as you're making a submission or updating, my goal in creating it was to create a tool that would be helpful in kind of pointing out what things hinge together. So risks and benefits, that's going to be the risk and benefit assessment. The protocol will also mention this, and the informed consent documents will sometimes say this. They may not say it the same way, but when the informed consent document says, what are the risks to you? What are the benefits to you? If the risk and benefit assessment smart form, you say there's no direct benefits, and then the informed consent document, you talk about a bunch of different benefits. That might be something to take a look at for making sure that things are formatted in the same way and referring the same way. Subjects and enrollment, there's a couple of different places where this will come up. And I'm not going to go through all of these in detail again, because we'll be posting the slides, and this is designed to be more of a resource. But study subjects and enrollment. If you're collecting data on somebody and you're going to be talking to them or observing them and you're getting their data, they're going to be considered a subject. And you just need to make sure that throughout all of these smart forms that's taken into consideration. Subject screening, there's a couple of different places where this will come up. Recruitment, if there's going to be a screening script, if you're doing phone screening or if you're screening people through that, just make sure that the screening script is there. Participation time. This is another one where it is for regulatory purposes and for the IRB, but it's also for the subjects. So subjects need to know approximately how long they need to expect to be involved in something. So if it's going to be 30-minute sessions 4 times over the course of 3 years, that would be something to make sure that is consistent across the forms and also in the informed consent document. And this is partially because there's just a big difference from a subject's standpoint, whether this is a 5-minute questionnaire once versus 10-minute questionnaires every month. So it's another way of making sure that we're giving the subjects all the information they need to make an informed decision. Collecting follow-up data. If you have an intervention or a procedure, you're going to be following people afterwards. It's something that needs to be documented within the smart forms. Pregnant subjects, this one comes up too sometimes. So we sometimes see studies that will be targeting children. So infants ages 0 and up to toddlers 3. Well, those subjects are not obviously falling into this category of subjects that may become pregnant. We define that as 9 to 62. But if you're also interviewing their parents, then you do have subjects who might fall within this category. And it may not be a risk to those subjects. A lot of the times it isn't. But by checking and making sure that the fact that there are subjects within that age range within the smart forms and notified is just a way of documenting to the IRB, yes, there are people who might be pregnant, but there's not any risk. So these all are smart forms and details where the issue of pregnancy or becoming pregnant might come up. And then of course, in the informed consent document, if there's any pregnancy testing or reproductive risks, that needs to be in the ICF so subjects know. Collecting sensitive information. This is another thing that comes up. So within the protocol, if you're going to be asking about mental health and you have questions about suicidal ideation or suicidal tendencies, that needs to be in the protocol. And our investigator guidelines say you need to have a plan for identifying if you have subjects who are suicidal and then providing assistance to them. So sensitive information can span a couple of different smart forms too. A lot of the times it shows up within the social and behavioral section, and then it also shows up in the certificate of confidentiality determination page too. And so it's just something to keep in mind. Sometimes questionnaires will ask about alcohol or drug use or recreational drugs, and it may not be sort of the main gist of the study, but if you're using that as one of your covariates, if you're collecting that information, it's something to make sure that it shows up in the certificate of confidentiality determination page. Identifiers, and then video and audio recording. So identifiers, we have a page on our website with all of the HIPAA identifiers. It has all of the information about what you're collecting from people and whether or not it's going to be under that protected category. So it's something that also can sort of show up in different places. So we have specific smart forms that talk about HIPAA authorization and then identifiers. And then we also have this information sources and identifiers page. So one of the things that sometimes happens is if you are emailing subjects a gift card at the end of the study, but you're not collecting their email, other than that, they come in for a session, they do a half-hour test on campus, they go home, and then you email them later. You are getting their email address. So on the information sources and identifiers page, if some of these things are going to be collected, it's good to just double check to make sure that all those questions are checked. The same thing with video and audio recording subjects. So we do have a recording consent addendum that's used for, it's put at the end of the informed consent document, and it has information about whether or not subjects want to be recorded, whether or not they're okay with using the recordings for this, that, or the other. So it's something that's often mentioned in the protocol. And then that addendum, if you are video or audio recording, goes at the end of the informed consent document. And then on the information sources and identifiers page, biometric identifiers, and then full face photo image. If you're taking a video of somebody sitting doing an interview, you will have that image. So it's just things that are easy to, that hinge together but can be overlooked. Now revisions. So revisions can change a lot of things within a study. And so sometimes it is useful to consider sort of more specifically what is going on within a revision and what other smart forms might be impacted. Chris?
Yeah, so before we move on to revisions, on the staff smart form page, to what extent do you list study personnel? So for instance, if you're doing a study that involves investigational drug service, on your delegation log, you may have your investigational pharmacists, but they're not listed on your IRB smart forms. So is it the HIPAA authorization that grants them the ability to see that PHI, et cetera? Because we have manufacturing of immunotherapy products that's kind of similar in a way to what IDS does. And so we see them as similar to IDS folks. So did they get the authority to get that information based on the language in your authorization?
So this is something that might be study specific. Generally speaking, if somebody's going to be approaching subjects or consenting them, accessing their information, those are the people that would be listed as study title and staff. There are a variety of other mechanisms for granting authorization to other external parties for accessing specific data. So things like confidentiality agreements, data use agreements, stuff like that can fall under a slightly different category. So for study title and staff, the main focus is people who are going to be directly interacting with subjects or their data. But this might be something to just give us a call and talk about more specifically within the context of your protocol.
Okay, thanks.
All right. So revisions. Yeah, so revisions can change a lot within a study. And it's useful to at least talk about this, partially because we did update our revision smart form to collect information in a little bit, what we hope is a little bit easier way for you all when it comes to providing it, and makes it easier and more quick for the reviewers to see what's going on. So changes to a study, it's going to be in the revision smart form. We ask that you list all of the changes being made and itemize them. So updating your informed consent document is one item. Updating your protocol, if you're adding staff, that would be a new thing. And then the justification section is really a tool for you all. So sometimes when you make changes to a protocol, you're making them for very specific reasons, but it's not always something that you're going to directly say within the protocol. If you're switching out one survey for another one because it's going to save your subjects time, the protocol itself is just going to be changed. It's going to be modified. But the justification section within the revision smart form is where you can say, this is why we want to make this change. It's going to lead to better data quality. It's going to make things easier for subjects. So it's an opportunity for study teams to sort of give that additional context, because a lot of the times it's that context that really helps reviewers and IRB staff figure out, okay, this is why a specific change was made. And it makes the process a little bit easier. Updating procedures. So we have a couple of specific smart forms, or we have a couple of specific questions within the revision smart forms that sometimes get overlooked. So changing study locations, there's a question 6. Usually the answer is none of the above, but this is the one where it's study funding, changes to PI, changes to location, additional removal of study procedures. So if you're adding a new place where you're recruiting subjects, or you're adding a new location where you're going to be administering the procedures, definitely that gets described at the top and under what is being changed in the revision. But then in question 6, just make sure to double check you are changing where the study is being conducted, the locations. And then within other smart forms, study locations come up a lot. So we do have the specific study location smart forms. Study funding, this is something that is a fairly common type of revision. So there's the specific study funding smart forms, and then the informed consent documents often need to be updated too. And again, all of this is in general. There are obviously study specifics that may or may not be applicable, but the idea is to sort of have an overview of things that might need to be changed. And then updating study staff. So I mentioned a little bit earlier, when it comes to updating study staff, there's a variety of different smart forms that might be impacted. So the informed consent documents, the protocol, the recruitment materials. If you have flyers that are telling people, here's the phone number and the email address of the coordinator, when the coordinator leaves, those things will need to be updated too, because if somebody's not there anymore, they're not going to be able to help with that recruitment process. So it's just a good kind of reminder of all of the different things that might flow from an update like that. And the last up is adding and updating documents. So we do ask that documents be submitted in Word or PDF format, depending. Usually we prefer Word format because this allows for track changes. And it can also be stamped with the IRB number. So changes tracked are a big thing. We see a lot of studies come through here. We see several thousand studies and even more revisions. So by having the changes tracked, it makes it easy for the reviewers and the IRB staff to see specifically what was changed and to know, oh, they changed study location. These are the other smart forms to check to make sure that everything is is ready to go there. So for changes tracked, we ask that when you're updating a document, you use that. If it's a document that already has old edits, we ask that you accept those edits before making new edits. And the goal here is we want to see what's changed with this specific revision. If there's several different layers of revisions tracked within the document, it can sometimes get a little bit confusing. So it's just a way of, again, making sure that the reviewers and the IRB staff can tell specifically what's being updated. Comments from study staff, those would need to be resolved before turning a document in. Sometimes people will leave questions for one another to see the conversation there. And again, we just want to make sure that we have sort of the most up-to-date version and that all of those issues have been resolved if applicable. And then when it comes to updating documents, we ask that you don't just delete an old version and then re-upload a version. Instead, the smart forms have a way of replacing versions. And the MyIRB Researcher Manual has instructions on how to do that. And this goes into being able to track the history of different documents through the system throughout time, making sure that we know when things were added or things were changed or things are updated. So these are things that sometimes can come up. All right, so are there any questions?
If you accidentally delete one of those forms instead of replacing it, are you guys able to track that, or is it's gone and then there's no way to recover from that issue?
So if this is it'll depend a little bit on the specific document. If this is something that is stamped,
the protocol, like if it's the protocol.
Yeah. So the protocol, if you just deleted the item altogether.
Yeah, in the midst of doing a revision, instead of uploading, you accidentally deleted it. Now you want to upload the revised version. Is that deleted version gone?
The deleted version will likely be gone, at least in terms of the specific mechanism that tracks it from revision to revision. But tracking changes is sort of the big thing when it comes to things like protocols, because that's what lets us see what has changed. So we ask that you not delete them if possible, but I mean, we know things happen. And if we've got track changes, that goes a long way towards making sure that things can be processed as smoothly as possible.
I kind of have one other question, but I can wait for anybody else if they have a question, because I know I've asked a couple already, so.
And any other questions?
Well, my other question was just about reviewers and what the process of, I mean, I know you sort of went through, this is the process of how things go, but I'm sort of, I have had sort of limited experience with the IRB, but I guess my question is more about how, I guess, is it, do the reviewers have latitude to, things are different across reviewers, or is there sort of a systematic process to keep things consistent in terms of what's important to one reviewer versus another, or is it just, do they follow, so here's the IRB's sort of way that they want things done, or is it sort of the reviewers shape what that process looks like? I know that's a very weird and nebulous kind of question, but it's more like the culture of the reviewing process and how that works, and ways that you can make sure that, yeah, if you follow these steps, then you'll be you'll have a favorable outcome, versus reviewers sort of dictate how that really looks, irrespective of what sort of the IRB templated format looks like.
So let me take Lauren, if you permit, I'll answer this question. So this is more a question. So let me start from the very beginning, which is not part of your question, but I wanted to, so IRB is multiply ambiguous. IRB is ambiguous between the IRB administration and the IRB board. And so your question is about the board, which is understandable, and the consistency of review. So when it comes to IRB reviews as it pertains to the board and individual reviewers, what is consistent is the regulatory goalposts. So we have federal regulations, we have state regulations, and then we have local rules that we all have to observe. And that is not negotiable, obviously. There is no subjectivity of review with respect to regulations. However, when it comes to evaluating details what's permissible under regulations, there could be some variation between individuals, but I feel like I'm stating the obvious because no two individuals will think identically about the same matter. However, I should point out that most of the decisions that the board makes are unanimous. I have seen very few dissenting opinions. Controversies are usually resolved very easily. So I don't see that variation in the sense that we are presented with the facts and that we have diametrically opposing worldviews on how certain matters should be treated. But however, when it comes to the very tiny details in a study, there could be some variation there, but that's not even within a standard deviation, right? It would be negligible in that sense. So if you were to ask yourself, okay, if I have an expedited study, does it matter whether it goes to reviewer A or reviewer B in terms of how easy pass will I have? I think it doesn't matter because your study passes through several hands. There is pre-review, who actually processes the study from and raises all the mechanistic flags with respect to my IRB, and then of course regulatory flags. Then there is another set of eyes from the reviewer and so on. So it's a fairly good process, and I think a helpful way of thinking about it is on the peer review model, really. So I hope that helps some in answering the question.
I appreciate your answer. Thanks.
Yeah, and of course, depending on the specialty, and so when you talk about subjectivity of review, we shouldn't think about it in terms of relativistic notion. What's good for me may not be good for you. It's not that. It's just that what one may focus on may be colored by the specific aspect of their background. You know, anesthesiologists may actually be uniquely qualified to really hone in on details of a study that has that component, while somebody who is a psychologist may not hone in on those details. But that's a welcome thing because that's why we have a board composition we have, because we have different points of view and everybody contributes that specific area of expertise to the study.
Thank you.
Sure.
Chris, you had a question?
Yeah, so as far as pre-review goes, do you guys have a standard operating procedure as far as pre-review? And we submit a lot of studies that are very similar, but we're requested by different pre-reviewers to change something that was acceptable to another pre-reviewer. So, trying to figure out, who's going to get it, what the right answer is,
yes.
What's going to be acceptable gets a little bit frustrating, on our side in getting, putting together, a quality submission, that, passes, pre-review, similarly when the projects are similar in nature.
So Chris, this is a great question, and we are very sensitive to that question. We do have obviously SOPs, and obviously there's a standardized training. However, pre-review is an art, as you might expect. Each case is different, and where things may vary is as you're subsuming individual cases under general forms. And this is where variation could occur, where the way you interpret something might be slightly different depending on the case of hand. But of course, we welcome any feedback, because wherever there is some obvious inconsistency, we are more than happy to address it promptly, and that's the goal, standardization. But there's going to be obviously the checklist approach doesn't work, because things are not black and white and each study is different. So even in similar cases, there are going to be, we like to say the devil is in the details. The details do matter. So, but yes, the goal is to standardize as much as possible.
Okay, thank you.
Thanks.
All right, have we got any other questions? We are basically out of time. All right. Well, thank you all so much for joining us. Hope this was helpful. As always, if you have any questions or concerns, feel free to reach out to us, and we are here to help. So have a good day.